Our next presentation is Autism as a Spectrum, a symptom of several different biological entities. And our presenter today is Dr. Jerry Kartzinel. Dr. Kartzinel is a board-certified pediatrician and a fellow in the American Academy of Pediatrics. He specializes in the recovery of neurodevelopmental, chronic neuroinflammatory diseases, and hormonal dysfunctions. After receiving his medical degree at St. Louis University School of Medicine, he completed his residency in pediatric medicine in the Air Force. And following Desert Storm, Dr. Kartzinel practiced general pediatrics in a private practice for 10 years until his fourth boy was diagnosed with autism. A nationally recognized speaker and New York Times bestseller author, Dr. Kartzinel has presented medical interventions that work to improve the lives of his patients who suffer from many types of medical conditions that include autism, allergies, inflammatory bowel disease, chronic constipation, chronic diarrhea, sleep cycle disruptions, and hormonal imbalances. He regularly teaches continuing medical education courses on children's health issues to physicians and other health professionals. How does diet impact a child with autism? Dr. Kartzinel is a leader in treating our children, and I know you're in for a big treat today. I want to remind you, you're going to want to take notes furiously. You can get copies of this presentation. Enjoy the presentation and know that you can get copies and take notes from the video as well. So please welcome Dr. Jerry Kartzinel.
We'll go ahead and we'll use this and just let me know when I can turn this off. All right, well, I am Dr. Jerry Kartzinel, and we're going to go over today and talk about treating This is off too? No. Hang on.
You have to hold it right in front of you.
Oh, like that. There you go. Okay. Not like that, because you can't hear anything. But like that, you can. Okay, well, I got to tell you, I don't treat autism. So if you're here for a treating autism seminar, I'm the wrong guy. I treat underlying medical problems that do seem to accompany autism and Asperger's. That whole spectrum of diseases, these children and adults have medical issues that we can treat and make them feel better. And I've had, especially the Asperger's, come up and tell me, why are you trying to fix me? I'm not broke, I'm just fine. And I'm saying, well, if you fell and broke your arm, would you want me not to treat that? No, you put that in a cast. Well, if you come to me and you have constipation or diarrhea or you can't sleep, can I fix that so your quality of life improves? And all of a sudden they understand what we're trying to do. In fact, if you are a professional who is teaching these kids, do you want to treat an autistic child who's been up all night screaming, or do you want to treat an autistic child who's been sleeping all night, woke up and was able to eat breakfast and have a bowel movement? Well, I'd rather take care of that kid and try to work with them. You know, if you almost think of these kids, and I'm a guy, so I kind of simplify things. If you think of these children and adults as a computer model, I fix the hard drive. My therapist, my speech therapist, my physical therapist, my occupational therapist, they're these software loaders. They're trying to load information into the software drawer, but if the hard drive isn't spinning right, or it's too sluggish or too tired, what they're doing is going to be very difficult. So we manage gut issues, which we call GI issues, sleep issues, allergic issues. Many of these kids have lots and lots of allergies, and if you've had allergies, especially in the spring and fall, you know you're not at your best. Immune issues, a lot of recurrent illnesses, ear infections, sinus infections. Neurological issues, you know, 30–40% of our kids have epilepsy. Some of these kids have diabetes. There's a lot of things there that we can work with. Endocrine issues, the thyroid issues, the hormone issues are off on many of these children. They have a lot of inflammation. We're going to talk about these things, and of course toxic issues. When we manage these issues, whatever they have on this spectrum, whatever you want to call it, PDD, NOS, high functioning autism, low functioning, whatever, those symptoms improve. Now, it's not like we haven't seen this before. Even when Drs. Leo Kanner and Dr. Asperger coined the phrase autism, and I guess Asperger's, you can see in the cases that they also had tangible tangible medical issues, such as, like case number 1, eating has always been a problem. A lot of these children don't want to eat. Case number 2, large and ragged tonsils. That's the first part of the whole GI tract that we can actually see. And if these tonsils are inflamed, which is lymph tissue, and there's something wrong there, then we can assume that maybe further down the road, they've also got inflammation there. Nursed very poorly, vomited all food at birth through the 3rd month, and on it goes. The kids have medical problems that if we address, they can improve. So what we have is a combination of some kind of toxins, oxidative stress, inflammation, and the child's genetics, that's a DNA strand, you can get a disease. And that's why it's so variable. When you look at your child and then you say, well, how many other children are like my child? How many other children are like my son Joshua? You know, it's like, yeah, they fit under this dome. I kind of like it to 31 flavors. It's all ice cream, but chocolate's really different than strawberry, which is really different than pralines and cream, but it's all ice cream. We look at autistic children, and if you look at other people's autistic children, yeah, they've got some similarities, but they're really different, and they respond to different treatments, not like my child does. So there's these genetics involved with toxins and all these things. They come together and they spell disease for us, and then we have to try and figure out what's going on. So we look at the physiology. And this is just good science. It makes sense. Physiology is a study of mechanical, physical, and biochemical functions of living organisms. Now, what we see is there are consequences when these physiological functions don't appropriately work. There's consequences. And for today's talk, because I've only got 30 minutes and I have to talk really fast, we will talk a little bit about immunology. And there's shifting that causes these kids to be more allergic to our world or more autoimmune. My son has had autoimmune inflammatory bowel disease. He also developed this autoimmunity where he gobbled up the cells in his pancreas called the islet cells of Langerhans that make insulin, so he's an insulin-dependent diabetic. And he also made these antibodies that go after his thyroid gland, and he has most honorable Hashimoto's thyroiditis, and on it goes. Now, if you manage these, whatever else he has is going to be better. Obviously, if you don't manage diabetes, it's going to be pretty bad. They have gastrointestinal stripping because they are usually on a lot of antibiotics. Neurologically, they can have inflammation in the brain. They can have alterations in neurotransmitters of the brain like serotonin, dopamine, norepinephrine. And they can have these endocrine issues too. So we're going to talk briefly about these. I'm going to kind of like on a canvas just paint a little bit of what I do. You can go to mendingautism.com. And it talks about each of these things, what I do, with real dosing that you can take to your doctor and say, I want this fixed. If it's sleep issues your child has, you can go to mendingautism.com. If it's recurrent illnesses, or we're talking about the diet later on, this is a good source for you to go to. But when we see that the first part of what we're going to talk about, those physiological functions that what they call T helper cell 1 shift to T helper cell 2, what we see in my clinic is those dark circles under the eyes, or they can be very pink, or the eyelids can be very irritated looking. We call those allergic shiners. Eczema, fungal skin infections, oral thrush, that's where they have the white tongue. Little warty things like molluscum contagiosum or warts. From a laboratory point of view, we can look at autoimmunity markers, increased IgE, abnormal natural killer cell function, IgA deficiencies, lymphopenia, T cell abnormalities. These are just regular tests you do at, like Quest or LabCorp or any of it's just regular stuff. But if you don't do the testing, you won't know if your child has these issues. And what I always look for are things that I can treat, okay? So now we talk about the gastrointestinal stripping. And this is basically where the gut loses its ability to keep foreign things outside the body. I mean, when we dump stuff in through the mouth, this is all external things going in the mouth, and the body's got to process it just right and keep the toxins in there so they go out the exit port. Otherwise, they'll get in the body, and that's not a good thing. When that happens, there's a compromise of the gut's ability to keep foreign things out of the digestive tube, and it allows abnormal things to grow. You get yeast overgrowth, you get bacteria overgrowth, you have poor function of digestive enzymes. I've had moms say, I see the bite marks on the French fries in his poo, or the poo smells like diarrhea, or it's brown, or it's green, or it's orange, or it's loose. Something is wrong in the tummy, and we can fix that. We can do laboratory analysis, and we can see that they have anaerobic bacteria growing. We can see if they've got yeast growing. A lot of our kids actually even have parasites that the laboratory will take pictures of and say, oh, look at this, we've got parasites. Well, maybe that's why the kid is absolutely scratching his hiney all night long, because he's got a parasite, because they do put a lot of things in their mouth, okay? And things happen and they germinate and grow in there. If we fix it, they're not miserable anymore. And of course, we can see, like here, the circled ones there show you some abnormal things growing, and the bottom one says Candida albicans. That's heavy yeast growth. All right, so we've talked about the immune system, we talked about the gut. Let's talk a little bit about what I find neurologically wrong with these kids. They can have problems with neurotransmitters, and that's why the doctors, when you first go in there, they say, oh, your child needs Prozac or Risperdal or something like that. And I ask two questions. One, how much of his autistic issues, the self-injurious behavior, the tantrums, the screaming, are somewhere between the mouth and the anus? And if we fix that, will those obsessive-compulsive behaviors, those transition issues, will they get better? And then eventually we have to say, well, what's going on in the brain and how can I impact that? Are there natural things that I can use to impact the neurotransmitters so they function better? And if that doesn't work, do I have to use the unnatural stuff, like the Prozac? I hate using drugs, but sometimes in my tool chest, I have to bring those out because that is defining who the child is. And if any of you have ever had anxiety before, you know that hurts. That is a painful condition. And as physicians, we're supposed to make these painful conditions better if we're doing our job right. Inflammation, allergies are very inflammatory. And I try and go after inflammation, and there's a lot of things that we can use for allergies, Claritin and Zyrtec or Singular, obviously not all of them. Inflammation in the bowels, whether it be a ulcer. When I was first getting into this, and I'm a guy, so I was a little slow picking this up. I had a autistic child, and he was a savant artist, and he was just miserable, I just was clueless. I had an idea what to do with him. And I said, can you draw me a picture? Because he's an artist. So I said, maybe you can teach me. I can be the student, you can be the master. And he drew a campfire right here. Oh, dude, you've got reflux, you've got an ulcer. Let's put you on some, Zantac or Tagamet. And within a couple of days, he felt wonderful again, just absolutely wonderful. So I've also learned in my years of working with these kids and being married for 29 years to my wife, I am the student. They're the masters. They will teach us if we just listen what works for them and what doesn't work for them. Infections can also be inflammatory. Antibiotics, antifungals, antiparasitics, antivirals. If you don't take care of the offending organisms that shouldn't be living in the human being, you're going to have this chronic inflammatory change going on in the body. And one of the things that I use just to ask the question, does inflammation play a role in this child's behaviors? I flip them some Advil or Motrin. And I do that maybe 3 times a day for 3 to 5 days. And if the parent tells me, oh my gosh, I didn't tell his therapist, but he's been a different kid this week on Advil, can we use it forever? No, but it does give me a clinical clue that inflammation does play a role, and I need to address that. I got to figure out what's inflammatory going on in this child, fix it, and I got a better kid. And then you'll see people talking about Celebrex and Naproxen and Actos, the evil thing called steroids. Natural things like Longvita, Neuroprotect, and natural agents, curcumin and omega oils and pycnogenols. Sometimes we think we're doing one thing, like giving kids omega oils, and we think, oh, because their brain needs it and it's helping the neurotransmitters and through the brain membranes and things, when we're actually just pouring a lot of water on the fire because it helps with it as an anti-inflammatory. All right, so we've talked about the immune, we've talked about the gut, we've talked about the neurological system, but what can go wrong with the endocrine system? They get these abnormal feedback controls. The thyroid has this very neat mechanism of just keeping the right amount of thyroid in your body. And of course, you have the adrenal gland making cortisol and adrenaline. Some of these kids have these dilated pupils and they're running around like, just constantly from the time they wake up to the time they go to bed. So there's something we can do that. Pituitary glands can have a problem too with how they regulate. And there's many other glandular functions that can be off with these children. Some symptoms that I see with thyroid: lethargy, abnormal weight gain, constipation. So if you have a constipated child, which half of you probably do, and then the other half has diarrhea, and then there's a group that's lucky and has both. Okay, so we have constipation, diarrhea, mental slowness, dry skin, thin hair, poor growth parameters. They're just not growing. They're failure to thrive. He's been the same weight for like 6 months, a year. Thyroid, This is all, you know, on my handouts and everything, the labs that you need to get, okay? The thyroid stimulating hormone needs to fall between 1 and 2. It's very important because that's what's called thyroid stimulating hormone. And if it's sitting at 4.5, your doctor will say, well, it's in the normal range. But that's not normal for children. Normal's between 1 and 2, so you have to understand that too. A lot of our kids don't take iodine, which is crucial for thyroid function. Where are they getting iodine from? And when they're eating 5 things. I mean, my son was only eating Chips Ahoy cookies, bacon, Fruit Loops, French fries, and a gallon of milk every day. And I did that for a while. Oh, and a Flintstones vitamin because I'm a pediatrician. Okay, that's not nutrition for these kids. Okay, all right. So, from a parent's perspective, what is autism? And you can even, like, the whole spectrum. When I say autism, let's just say the whole spectrum, okay? It's mismanagement of incoming stimuli from the 5 senses. That's really what it is. And the more they mismanage, if you let me use the word, the worser they are. And the fewer that they mismanage, the more normal they are. So when we move them from here to here, they're improving. That just means that they're responding to stimuli. Mom saying, I love you. Dad saying, go get your shoes. My son could walk on hot gravel in bare feet in the middle of summer. Now, all the nerves were connected from the feet to his brain, but his response to the stimuli, that's hot, that's sharp, I need to get off of here, wasn't there. Trying to get him not to climb on things that are 15 feet high. Dude, you need to get down from there. You bring him down, and guess what? He goes right back up. You know, it's like, okay, you are not responding to normal, everyday daddy stimuli here. What's going on? So they respond to sight, sounds, smell. The kids can't stand certain sounds. Oh, he doesn't mind this, but when I put on the vacuum cleaner or the garbage disposal, it goes crazy. But the fire truck can go by and he's fine with that. Or they're covering their ears all the time. Or lights bother them, fluorescent lights. Or it could be anything, clothing, tags, shoes, socks, anything. They're not responding what you would expect a child of their age to do properly. Cutting hair, brushing teeth, washing hair. I mean, my kid would scream every time we'd shampoo his hair. It's like, dude, we do this every night. What about this do you not get? But for him, you might as well just pour hot tar on him. He was just going absolutely ballistic. But he didn't mind his teeth being brushed. Other kids, why don't you just stick me with hot pokers in my eyeballs before you brush my teeth? What's with that? Abnormal response to everyday stimuli. What we're trying to do is fix that. What we see in our clinic very often is these foul-smelling stools, which can be any color on the rainbow, bloated bellies, no language, not sleeping, hard to get down, or they can go to bed nice, and then they wake up 2 hours later and they're up for the rest of the night. Anybody have one of those? Yeah. Okay. Does not do well running errands. I mean, gosh, we've got to go to Walmart, we've got to go to Target, we've got to go to the grocery store, and this kid does not want to participate. I have one little guy, mom was at Walmart, and she wouldn't take him to the toy section. There was just no way we're going there again. And she's pulling him out of Walmart, and he's screaming, call the police, call the police, call the police. Covers ears, strange sounds, tantrums, sometimes triggered, sometimes out of nowhere. I mean, I remember my son sitting in the most favorite place in the whole wide world, the shallow end of the swimming pool with his guys, his G.I. Joe guys, and he's just sitting there crying. And he didn't know why. He's just not happy. Fevers that come and go, not potty trained, no interest. Again, abnormal response to everyday stimuli. I got a full bladder, I'm going to use the porcelain throne. What's so hard about that when you're 8? Okay, these kids just don't get it. Odd body movements. They have some very funky positioning and way they creep and sneak around, or when they run or walk. And some don't. Some are fluid. I mean, they look great. Poor eye contact, nonstop moving, climbing on everything, language issues, repetitive play, not regular play, but repetitive play, restricted diet, physical exam. We have all kinds of interesting things we can look at when we do the exam to get clues. So bottom line is, what do I see? This is just a short little scenario of things that I see that I have to consider when I see a child with special needs in my clinic, and mom and dad totally exhausted saying, help me. So what do we try and do? Well, we try to remove the dietary stressors, the environmental stressors, bolster nutrition, relieve inflammation, improve the broken biochemistry, improve immune function, and detoxify them. Well, that makes sense. Heck, we all should probably be doing that. Okay, what do I see in my clinic? I see what I lovingly call the pregger belly look, and that can be on boys and girls, by the way. But two things about this picture is I just want to show you it does take time. This took 6 months to get her to go from that to that. Big belly to a flat belly. Now, can you imagine if your belly was distended to the point where somebody thought you were preggers and you weren't? How are you going to operate in school? How are you going to operate with therapists? You're going to be miserable. Can you imagine that much stool in your body deforming your body and you're okay with that? But too sadly, our physicians in the community are just fine saying, oh, that's just stool withholding behaviors because this is the only area of the body that the child feels, in complete control of. I said, what creature on God's earth willfully withholds a stool? Okay? Certainly not my German Shepherd. Okay, we can get x-rays. I mean, you don't have to guess about this. I mean, what makes a belly big in a kid? Well, it's either poop or gas, okay, or fat. And I mean, you can see white is dense, so that picture on your left shows a lot of white, and there's a lot of poop in that belly. And then, of course, when we relieve it, it's a whole lot better. And they can go from diarrhea stools and from in the diaper and sandy looking, even though the child doesn't eat sand, to nice squiggles in the toilet. And the good news about this was a Christmas card I got one year. If you look inside the tummy and you do the endoscopy, you can see, like on your left there, swollen. It should be nice and smooth, like the one on the right. But you can see these swollen lymph nodes, kind of like when you get a sore throat and you say, "Oh, got my glands are sore." This is down the digestive tube, and it hurts. This is down the swallowing pipe called the esophagus, and you can kind of see what I call that cobblestone. That's from regurgitation of food or reflux, and you're getting acid up there. That hurts. If anybody's ever had reflux before, especially when they're pregnant, they bubble up the stuff and it goes back down. It's not comfortable, and it'll eventually erode the tissue. And then we can look actually through with what's called a pill cam now, where they actually swallow a little pill, or it's placed when they're sleeping when they do the endoscopy, and it can take pictures all the way through the small intestine, and it will show you areas of ulcerations and pain. That's a picture of my son. I'm so proud of him. Isn't he cute? That kind of halo around it, that's an area, I mean, if you've ever had a canker sore in your mouth, can you imagine your whole digestive tube lined with canker sores? Miserable. And you're wondering why they're hitting themselves in the head and they're screaming and they're crying? Oh, well, that's just autism? I like to think, well, let's make sure it's nothing else, because I sure would hate to call it autism when the kid's in agony. So abnormal bowels are a big part of what I do, and that can be soiling, constipation, diarrhea, anorexia, wakening at nighttime, reflux, foul-smelling stools, breath, big old belly. We can do our laboratory evaluation, what I tend to look at. And we can get historical clues. The child was a difficult breastfeeder. Colic. I love colic. When I was in medical school, colic was about 3 to 4 hours of just a baby crying. And my son David would cry. You could set your watch 6 o'clock to 10:20 every night for 6 to 8 weeks. That's when we gave him to grandma. No. And he'd be miserable, but other than the time he's fine. Now I hear colic is, well, he's just a colicky baby. What does that mean? All the time he's miserable, okay? They can get infantile eczema, food sensitivities, failure to thrive, frequent antibiotics, always getting ear infections, abnormal posturing, and on it goes. But we can look at these things and treat it clinically, which is what's really exciting. And when you do, the stools improve, eye contact improves, word approximations may start, tantrums are remarkably improved, appetite improves. They just seem, how I call it, happier in the skin they're in. I just see these kids and they've got these frown marks. They almost like need Botox. They're just like wrinkled up. And they're just miserable children. They're just miserable. And their health improves. Diarrhea, 1 to 6 or more liquid poops a day. Some can be explosive, very foul. Some of the stuff coming out of these kids' exhaust port is really awful. You probably haven't noticed. How do we manage the diarrhea? Well, we remove gluten and dairy. Okay, we can do testing for this too, but if you're thinking about this today, this is stuff you can do without testing. You can start removing dairy, gluten, digestive enzymes, antibiotics, antifungals, antiparasites, adding zinc and fiber. Fiber is very important for these children. Constipation can look like that. Again, that's in a little boy. Can you imagine? And his doc wouldn't do anything about that. Well, he's too young to treat for constipation. Are you kidding me? I mean, there are regular things that cause this too, like Hirschsprung's disease, that somebody ought to be thinking about. At least send him to the GI doctor. But this kid was autistic, so all they saw was the autistic diagnosis and say, well, autistic kids just don't have bowel movements. And they can be done, you know, when these kids don't poo, they can not poo for 3-4 days, but maybe once a week or every other week. That's not uncommon in my clinic. I'm going, you're stooling every other week, really? And when they do, they're huge and they bleed and they clog the toilet. Okay. Yeah, see people, you talk to people, that's not normal, that's not autism. That's constipation, fix that for goodness sake. And then see what happens to the autistic behaviors and I'll bet you they'll improve. Well, there's treatments for constipation. There's lots of things that we have to do to make sure that they go every day, but that's what we have to do. And we just have to keep turning up the ratchet until we get, you know, 1 to 2 soft stools a day, especially if they've built up like that. And what I have parents do for me, just so I can have an objective number, is I'll have mom take a measuring tape and measure around the belly button, you know, all the way around the circumference, and the child will wake up 17, and that night he's 22 or whatever. We can kind of get an idea, give me feedback on how I'm doing. Soluble fiber helps tremendously with these kids, both with diarrhea and constipation. Dysbiosis is just a fancy name for bad bugs behaving badly in the bowels. In other words, things are growing in there that shouldn't be. And these things cause behavioral changes. I can't tell you how many times when you have an overgrowth of strep, they're very obsessive compulsive, or if they've got overgrowth of yeast, they're just these kids who hang upside down and they're laughing, they're giddy. It's just a miserable thing for them to go through, but we fix that. And yeast, this is what we call spaghetti and meatballs in medical school, and it's part of us dissociating from us. Anyway, we can check for yeast, we can grow it. Bottom line is we have to treat it with an antifungal. And again, on mendingautism.com, because I only have a half hour, you'll see how we treat yeast, step by step. Doses. If you want to go the natural way with oregano or caprylic acid, we've got that. If you say, forget that, I just want to go to fluconazole. I mean, if you think about it, when a woman gets a vaginal yeast infection, she doesn't say, give me herbs. Okay, she's asking for the fluconazole. She may take herbs to keep from getting it again, but when you're in the middle of it, you need that gone away. Same thing with these kids. Sleep, a lot of these kids don't sleep well, and we know that from studies done a long time ago that children and adults with autism do not make enough melatonin. Well, my son doesn't make enough insulin, I give him insulin. He doesn't make enough thyroid, I give him thyroid. If he didn't make enough melatonin, I would give him melatonin, okay? It's really easy. If that doesn't work, I add 5-HTP, we make sure they're getting calcium, magnesium, and the list goes on. And eventually I have to get into drugs, okay? Now, this is a study from 1990. It says a subgroup of children with very poor sleep cycles in autism. Wow, 1990. And if any of you guys have one of these children, your doctor isn't going to be aware of this. But this was done in biological psychiatry. A novel biochemical model linking dysfunctions in brain melatonin, propionyl, peptides, and serotonin in autism. So we know this stuff exists. And you say, hey, my kid's not sleeping, why wouldn't we want to give it? Well, here's a little guy. The psychiatrist thought he had a severe mood and thought disorder and said needs to put him on lithium. 1 more minute? Really? No, my watch says 2. Bottom line, this is my second boy, John. This is before autism was even on my radar screen. I noticed one day that I put him on, he put a bunch of pancake syrup on his waffles and just went crazy, and we took him off of sugar, and he was no longer Dr. Jekyll and Mr. Hyde. His brothers had other names for him that I can't repeat here. All right, so I think we better end there. There's a whole lot more. Go to the mendingautism.com website, read about each of these different things. I just wanted to present to you today that there are biomedical interventions that we can do, that these kids present with. We can test laboratory-wise, but the bottom line is we don't treat paper. When I do this, what do I get? And the kids improve. I give you melatonin, my kid's sleeping the whole night. Great. We changed his diet, he's no longer tantruming. Okay? Thank you very much for your attention.